Hello, everyone. Welcome to another episode of the Anti-Pharmacist podcast. I hope you enjoyed your weekend. Well, last week was one of a kind. It was like holidays back to back to back to back. And I wish that all weeks were like that. But then, what can we do? Work must continue because no work, no money, right? So it's another new week, and today I want to talk to you about something. It may look ordinary, especially for everybody that takes medication. But have you thought about it? You see, there are many dosage forms of medications, right? We know about the tablet, the capsules, the syrups, the suspensions, the suppositories, the pessaries, and all of that. But then, the most common ones are the tablets and capsules, right? We even have the creams. Remember, we have inhalers as well, you see. But the thing is, most people take the oral dosage forms. There are different routes of administration. There's injection, there's subcutaneous, oral, there are enemas. But most people take the oral form, the one you pass through your mouth into your system. Only a few people take enemas or suppositories. Only a few. Injectables are fairly higher too, but not as much as oral still. So what am I getting at? It just crossed my mind that how do people actually take their medication? Like you listening to me, how do you take your medications? Do you use water to swallow them? Do you put the drug in your mouth, then use water to push it down? Or you put water in your mouth and place the drug and swallow? A lot of people take their medications in different ways. And I think there's a joke around this one. How do you take your medication? But what I actually want to discuss today is, there are some people that find it difficult to take medications of any kind. They are just irritated, regardless of maybe it's capsule or tablet, even if it's coated, anything. They just don't want anything in their mouth that is not food. You understand? So they are irritated. Before they even take it, they start retching, like they want to vomit. That's why some people come for anti-malarials, for example. They want the soft gel. They don't want anything that they would taste or smell. Fine. But then, even after that, there are some people that cannot swallow medication. Some people, they will wrap it with food before they can swallow. Others, if they don't have juice or Coke, they cannot take medications. But I've talked about food-drug interactions in the past. And it's not all medications that you can wrap inside food. It's not all medications that you can take with Coke. I do not even advise it. Some people even go as bad as using alcohol just because they cannot tolerate taking medications just like that. But the best liquid to use for your medication is still water. I told you, right? But today, it's even what I'm thinking about is different from this. Can you guess? Well, I've already given you the T from the topic of this episode. And it is, do you eat your medications? Surprised, right? Well, let's get right into it. So, what brought about this topic? Like I said, a lot of people, they can't tolerate taking medications. So some people actually eat medications. It will even surprise you to know that no matter how bitter that medication is, some people cannot swallow. They must crush it first and eat. But do you know that not all medications should be crushed? Not all medications should be eaten. Some, once you crush it in your mouth and you now swallow, you have neutralized that medication. You cannot take it, will not work anymore. Then you'll be wondering why you took this medication and it didn't work. Of course, we know that some medications do not have pleasant taste in the first place. So it might be difficult for some people to crush, to eat, to chew. But some people still do. I remember then my grandma, when she was older, and she had some medication she was taking, we used to actually find a way for her not to chew. And there are grandmas like that, there are people like that. So I'm bringing this to you to know medications that should not be chewed. Either they are sweet or they are tasteless or they are bitter. There are medications that should not even be chewed at all. Like I just mentioned now, the inability to swallow medications is often related to age or certain medical conditions. And some people don't like it because of the size, the taste, or just the idea of the pill just makes them nervous. So, whatever your reason is, it is important that you find a way to take your medication regularly so that you can get full benefits. And some people take these medications every day. Crushing, splitting, or chewing certain medications can increase the odds of experiencing side effects. It could also make your medication less effective, like I mentioned. So, you have to know which medications you can chew and others that there is no way you must not chew. No matter what, you must find another way to take it. Okay? There are medications that are known as immediate release medications. They work quickly, but they have to be taken multiple times a day most times. Then there are modified release dosage forms. That is, they have extended or delayed action. Alright? So they are not released on time in the body. The release is regulated by maybe the coating technology. These ones, their actions last longer, and you may not have to take them as frequently as the immediate release ones. That is why some medications you see XR, you see SR on them, and you'll be wondering what's the difference between metformin and metformin SR or XR. What's the difference between carbamazepine, the Tegretol that we know, and Tegretol CR? These are the differences. Controlled release, immediate release, dosage forms, alright? Let me quickly decode what these things mean, alright? So let me quickly decode what these things mean. DR means delayed release. ER or XR is extended release. MR, modified release. SR, sustained release. CR, controlled release, alright? And all of these, they are not immediate release medications, like I mentioned. The release of that moiety, that particular active pharmaceutical ingredient from these medications, is delayed or modified or controlled based on the coating technology, just so that you can get the maximum benefit, and you have to take it less often than the immediate release, alright? And it's to help the absorption profile better. So these kinds of medications are not to be chewed at all. You should not crush them, split them, or chew them. I know some people even go to the extent of first crushing these medications, then pouring inside liquid like Coke, like juice before they take. You are just wasting them. That way, it is not advisable. Don't forget that drug-food interaction is there, not to talk of risk of increased adverse effects or even risk of therapeutic failure. So those drugs that have special coatings, also apart from the release I just talked about, you should not crush them. Even if your medication does not mention a control release or so on the packs, there are some that have special coatings at their back. If you take a tablet of spironolactone, for example, or even ferrous sulfate, you see that it is shiny, it is coated. You should not crush those medications. These coatings are usually to prevent mouth, throat, or stomach irritation, and they can also mask unpleasant taste. So crushing them, you have, defeated the purpose. Then there is something called enteric coating. It's a specific coating that not only protects the stomach, but prevents the medications from dissolving too early. So it ensures that they reach the small intestine for better absorption. That is where the absorption is needed. So it's when it gets there that it is released. So when you now crush, split, or chew them, it could result in irritation and make them less effective. Also, there are some hazardous medications that should not be chewed or crushed or split. They are those that are used to treat cancer. They are cytotoxic. The fact that you are taking them alone, you are being exposed to great risk, is because of the benefits that you are getting from them, that you are taking them at all. So you should not be crushing them. Those that are used to treat different kinds of cancers, there are many. There's tamoxifen for breast cancer, bicalutamide for prostate cancer, many of them like that. Okay, there's letrozole. A lot of people buy that. There are cytotoxic medications, many of them like that. You should not crush them because they can cause harm to unborn babies. They can destroy sexual reproductive organs. They can destroy a lot of organs in the body because, like I said, they are cytotoxic. That is, they destroy cells. The real concern is for people who crush, chew, or open these medications. The powders created when these medications are opened or changed can be unsafe to people who are exposed to them. So, these medications should not be altered in any way. If there's any need to compound, which is very rare, it's only healthcare professionals that will do this, and they will use the right vehicle to make it safe for you to take. Alright. Then there are dissolvable dosage forms. Those are medications that are supposed to dissolve in the mouth or under the tongue. They should not be eaten. They should not be crushed. We have tablets that are sublingual, like nitroglycerin, for example, and loratadine too can be sublingual. You should not crush it. If you eat it, it's not the same as putting it under your tongue. Under the tongue is called the buccal cavity. Alright? And there is actually a pathway that leads straight to the bloodstream there that makes the drug absorbed and work fast. But if you pass it through your mouth and you have let your saliva mix with it and you are taking it through your throat, you have destroyed the medication. It will not work. The designs are sometimes used to improve drug absorption. Alright? Then there are some drugs that are made with special technologies, like amorphous solid dispersion, nanotechnology, all these nanoparticles now. Those kinds of medications, they must stay intact so that they can be absorbed effectively in the bloodstream after they have been swallowed. You should not even think of eating those things. Then capsules too. Capsules are typically powders, pellets, or liquids that are put inside specially formulated shells. You see, soft gels are another type of capsule made of soft gelatin. They cannot be crushed or chewed. So you have no business chewing your vitamin E capsules. They are soft gels, yes, but they're a type of capsule. You have no business chewing your vitamin A. You should swallow it like that. You have no business chewing Amatem soft gel or ibasonate. Those soft gel medications, you should not be chewing them. Capsules like amoxicillin, like Ampiclox, you should not be chewing them, alright? Of course, like I said, these capsules, most of them, they contain liquid, pellet, powders, and they can be opened or sprinkled onto soft food. But it's not the case for all capsules. Remember drug-food interaction. So, before you even think of, even if you have been doing it in the past, please, next time you go to the pharmacy, just ask your pharmacist, that fam, this is how I've been taking this medication. Can I continue that way? And see what they will say. They are in the best position to actually advise you on how to take it. Because I realized that we just hand over medications. Take in the morning, in the afternoon, at night. But how do you take it? We don't follow you to your house, do we? So this is why I'm talking about this topic today, so that you can know medications. If you have been chewing them in the past and you have been complaining that they don't work, paracetamol that I used to crush and put inside Coke, I used to use 2 tablets before, it doesn't work anymore. Now I use 4. You're harming yourself, not knowing that maybe it's because you are crushing it that it doesn't work. Alright, now I will just list a few medications for you that you should not crush. Okay, there are many, but at least the common ones that we take most times that you may be familiar with. Let me quickly list them for you before I conclude this episode today. Alright, so modified release dosage forms or special coatings like acetaminophen, that is paracetamol, but not the immediate release tablet that we sell. There are some foreign brands that are available, like the Tylenol. We should not crush those. Bisacodyl is also a coated dosage form, a coated tablet. You should not crush it, alright? Morphine should not be crushed, except formulated. You cannot even get morphine normally. You can only get it in the hospital. It's very controlled, so that is not even your business. But just in case, morphine should not be crushed. Amoxicillin clavulanate ER, what we call augmentin ER or XR, should not be crushed. Those are capsules now. Ciprofloxacin, anything in extended release, please do not crush them. I've talked about those that are in capsules like omeprazole, like lansoprazole, carvedilol, verapamil, diltiazem. those should not be crushed. Then the hazardous ones, I've talked about the anti-cancers like the tamoxifen, methotrexate, monoclonal antibody like imatinib, capecitabine, cyclophosphamide. They should not be crushed. Alright. Then those that have special technologies like the lopinavir, ritonavir, used for treating viral infections like hepatitis, like HIV. Then fenofibrate, that's an anti-cholesterol medication. Itraconazole, a lot of people know Sporanox. Please, they should not be crushed. You should swallow them whole. Alright. Then there are those that irritate the mouth, the stomach, and the skin, like your Atrotec, diclofenac mist or Prostol. They should not be crushed. You should swallow whole. Ferrous, it is coated. Do not crush it. Pyroxicam, it's a capsule. Feldine, Flexidine, do not crush. Alendronate, do not crush. Many of them like that. Then there are medications that leave a bad taste in the mouth. This one you don't have to be told. But there are some, they have lost the sense of taste. They can eat anything. They can eat no matter how bitter. They are used to bitter things. So they may not even know. Some people can chew flagyl, metronidazole. Please do not crush them. Like cefuroxime, I've mentioned ciprofloxacin, there's erythromycin, ibuprofen, you see, trazodone. Please do not crush them. Like I said, this is just a list of a few common medications that you might be familiar with or you might have heard of before. There are many. So if you know that you are used to chewing medications you can't swallow, please ask your pharmacist next time you go to get your medication. Please, fam, this is how I take this medication. Can I chew it? Can I continue it that way? Or is there an alternative for me? And that's another option. If you know that you can't tolerate swallowing these medications, they make you gag, like you retch, you cannot even think of it. You know, some people who have that reflex action, they can't swallow. Then you could opt for other dosage forms like the suppositories if they're available, like the creams and ointments, like the syrups, alright, like the suspensions, like the injectables. That will help you because the aim of the medication is to treat whatever condition you are using it for. What's the essence then if you already defeat the purpose even before it leaves your mouth? Now, talking about splitting, alright, we've talked about chewing, crushing, splitting. There's something we call scoring. There are medications that have lines in the middle. Those are called scored medication. That is to tell you that those that made that medication, they have sort of divided the active pharmaceutical ingredient into two equal parts, and that is where they put the line. So, which if you cut it into two and you take one half of it, you are taking exactly half of the strength of that medication. So those can actually be split, but not all medications. Those that do not have that line, it is dangerous for you to split them. That's another thing we should take note of. When you are buying medication, maybe you want to extrapolate the dosage of the adult to the child. You don't have the child's dosage form or the strength, and maybe something of 500 milligrams, and the child needs 250 milligrams. I say, you can just cut it into two. It's not like that because the manufacturers have actually not scored it. So you cannot be sure that once you cut it into two, you are taking exactly half of the medication, like half of the strength. You are not sure. Because what if the side you cut actually contains more of the pharmaceutical ingredients than the other side? But when it is cut, then it is definitely safe to cut, to split into, then you know you are taking exactly half of the strength. But if it is not scored, it is not advisable that medication should be cut into two, just like that. You understand? If you don't have an option, or if that's how you've been taking your medication, please let your pharmacist know. They'll be able to guide you. Maybe there is another type, another brand that will be scored, or another brand that will have that exact strength that you need. Now, if you still find it difficult to take medications, like a particular medication, for example, maybe a tablet or a capsule, and there are no alternative dosage forms, you don't have a choice, you still have to swallow it now. Since you want to treat your condition, except you don't want it to get treated, and I know that you don't want that. So there are strategies that you can use to swallow your medications easily, or make it easier for you to swallow. So let me just give you a few tips, like a few points. The first thing is take with a full glass of water. Alright? Close your eyes tight. Just, especially for medications that do not have any taste, put them on your tongue and just use your water to push it down. Or pour the water on your mouth, put the medication and swallow it immediately. Do not let it touch your tongue. Before you know it, you have taken it. And if you are still in the habit of wrapping it in your eba, your fufu, your pounded yam, please just ask your pharmacist first if that can be done. If that makes it easier for you, why not? And if it's juice you want to use to take it, just be sure to first notify your pharmacist or your doctor that, okay, can I take this with juice? Can I, because of that food drug interaction or drug food interaction that I keep talking about, that it's very important. Then for these cold medications, splitting them. How can you split them? The best way to split them is to use a tablet cutter. They sell them in most pharmacies, and if not, a very sharp and new blade can do. Alright, it's not one that is blunt though, that you have used to cut your nails, used to cut different things. You're not using it to cut your medication. You might just contaminate it and introduce even worse germs into your body. Get a sharp blade or a tablet cutter, and you're able to, split it into. Then the other one, please make sure that you keep it in a very safe place. There are pill counters, pill boxes, pill sachets, those things that they put your medication. You can ask your pharmacist, please give me 1 or 2 since I'll be cutting this medication. Because most medications are in blisters, right? Once you remove it to put the half back, you may just start losing your medications and it may start chipping off. So just take those small envelopes, get 1 or 2 from your pharmacist, and you put your half inside it. And make sure that that is what you use next. Don't start storing halves down. You may start chipping and you don't want all of that. You may start losing some parts of the medication. So that's what I brought to you today. I hope it has been able to benefit you to an extent. As usual, if you have questions, comments on this topic, please do not hesitate to send them to us via the various channels on X, on IG, on LinkedIn. Yes, I've started posting on LinkedIn now, or via our mail, antiPharmacistPodcast@gmail.com. We are open to collaboration, guys. If you have something to say, if you want your voice to be heard in the health space, please just message us, send us a mail, and we'll talk. We'll take it from there. Also, please, as you listen, please share, subscribe, follow, do all of that just to help the podcast to grow. All right, I know I promised you a lot of content and I'm working on them, really working on them. You'll be seeing a lot of changes in coming episodes, that I promise you. But it's still premium content, right? And it's been benefiting you, so please, why not share? Don't be a selfish person. All right, so I'll see you again on Friday for another TGIF episode. Till then, stay healthy and God bless you.